Syphilis, the silent infection. Please listen attentively, whether you're a man or a woman. If you've been noticing any of these or see someone that has any of these, then listen attentively to this video. In this video, we're going to be talking about syphilis, the signs and symptoms of syphilis, how to know you have syphilis, and how to treat syphilis. Syphilis is a silent infection. Please, it's a silent infection. Don't even wait for when you start having signs, because by the time it happens and you didn't know the first stage, second stage, third stage, and it enters the final stage, there are consequences. Which one of them is kidney failure, neurological issues, blindness, deafness, and all. So let's get to it. My name is Nurse Merit and I'm a nephrology nurse. Syphilis is a sexually transmitted infection. Okay, it is gotten through sexual intercourse, vaginal sexual intercourse, or through anal sexual intercourse, or through direct contact with the sore or cankering. This is it, and I will also show you too. So when you have direct contact with somebody that has syphilis or syphilic cankering or this sore, you can get syphilis, but mostly it is gotten through sexual intercourse. A mother can transfer syphilis to her child too, on rare occasion through childbirth and all. On rare occasion, you can get syphilis through blood transfusion, very rare, if the blood is not properly screened well. Now, let's get to the stages of syphilis, where we will now get to the symptoms of syphilis. There are 4 stages of syphilis. There is a primary stage, there is a secondary stage, there is the latent stage, and then the tertiary stage. The primary stage occurs when you've been exposed to the infection. Now, after being exposed to the infection, 4 weeks, 3 weeks, 6 weeks later, you will notice these symptoms, such as this sore or a cankering, and it's usually painless. You won't notice any pain, or you usually notice this where you got the infection. If it was through kissing, you get it here. Vaginally, you get it in your vaginal area. In your penis, you will also get it. So it's these things, you may not even know that you have it, because there is no pain, there is no itching. Unlike every other illness that has itching, there is nothing. It now disappears on its own. When you notice something like this, please don't keep. Yes, because it is a silent infection and it goes on incubating, staying in your system until it causes serious problems for you. So it disappears when you don't treat it. You don't even know. You think everything is okay. It disappears on its own. It enters the second stage after like 2 months or 3 months, which is when you now start having fever, you start having joint ache, you start feel like vomiting, you're tired, and all of those things. You may take it likely to be malaria symptoms or just normal food poisoning symptoms, but it's still syphilis. If you leave this and you didn't go, because there is nothing, your genital place will not itch, it will not be producing all those things that normal infection produces. This is why it is a silent infection, and is there causing issues for you. If nothing is done, it now enters into the latent phase, where those signs it showed you before stopped for years. I'm talking years, 5-10 years. This infection will be in you, eating you up, destroying your organs. After 10 years or more years, if you decide, probably your immune system is now low or something, it decides to now show off, it now entered the last stage called the tertiary stage, which is the deadliest stage of syphilis. At this stage, you can now have blindness or deafness. It can enter into your spinal cord. It can cause issues. It can cause spinal cord irritation. You may have heart issues. You may have kidney issues, liver issues. The bacteria must have multiplied, and messes up your organs, it becomes so serious. So having known about the stages of syphilis, so when you notice any of this sign, be attentive to your body. You must not wait for you. That's why I always tell us to go and have ourselves checked. There are ways you can actually check if you have infection, sexually transmitted infection. You just to go to the hospital, tell them you want to run sexually transmitted infection test. There's what they call it, but just tell them this on a layman language. They will run series of tests, including syphilis, gonorrhea, all those things, and find out if you have them or not. And even yeast. At least once in some months, you go and check yourself. So now, having known about these symptoms, when you notice, let's come to treatment of syphilis. Or, okay, how do you know you have syphilis? First of all, when you notice these symptoms, you have to go to the doctor. The doctor will now, with your history, and now take some samples from you, either from blood and then from your discharge and all, and then run a test for you. Then we'll find if you have syphilis or any other kind of infection. How is syphilis treated? Just like every other sexually transmitted infection, I keep saying, when you notice any of these signs, especially the initial sign of painless sore, please just go to the hospital or go to a laboratory and run the test. They will run a test for you, okay, with your sample, your specimen. After running the test, the doctor will now see you and then write proper prescription for you based on the results that you have. Don't just go to the pharmacy. I keep saying this thing. Don't go to the pharmacy. There is no lab results. They won't know the drugs that you have become resistant to. And this is why your infections keep coming back. Okay, so when you run the test, the doctor sees you and give you a prescription. Afterwards, finishing that your drugs, you still come back, whether you have the signs or not. Check if you still have those symptoms. Check if you still have the bacteria again in the test. You have to redo the test, and if it is clean, you know you're clean. Okay, now if you are using a laboratory, same thing. After you finish, take the prescription, the result to a doctor, okay, who will now run you a good prescription, okay, or even a pharmacist with your lab results. Now, let's talk about how to prevent syphilis. Prevent syphilis by number one, practicing safe sex, using condoms, and not sleeping with anybody that you're not sure of without condoms. Okay, you can actually run a syphilis test right there. Just get it in the pharmacy, syphilis kit. Take the blood, run, you and your partner, you're sure. Same thing as HIV, you're sure. Okay, meanwhile, HIV own is quite somehow. I have a video on HIV. If you have questions about HIV, how to give birth with HIV without infection, how to have partner, marry somebody that is HIV positive without you guys without you being infected, I just look at the video on HIV. So these are ways you now stop sharing your sex toys. Do not give your partner, another person, your friend, your sex toys. Maintain adequate, healthy lifestyle, okay? And anybody you see that has this thing, just be careful. All right, so like this video, share, make sure you subscribe, and let me know if you have more questions.